Do I need psychiatric medicines? Let's see in today's videos some of the common myths, misconceptions about medicines in the psychiatric treatment in general for our mental health. So, once um, you start psychiatric medicine, you will have to take them for life. This kind of preconception many people have. These medicines will change your personality. I don't want medicines. I just need to be mentally stronger. And have you ever heard someone say, or maybe sometimes your own mind says these things, I don't want medicines. I just want to be a little courageous and stronger. Or maybe let me just talk to my friends and everything will be fine. So, these are some of the most common concerns. I can say sometimes the concerns are so much that they get transferred into fears people have about, especially about psychiatric medicines. Now, there are so many other illnesses, but people have mainly these kind of concerns only for psychiatric medicines. That's the irony. And because of these fears, many people delay treatment. They stop medicines on their own or continue to suffer silently for months, not taking help, suffering in different areas of their life, maybe staying aloof, alone. The anger is taking over them. The quality of lives completely changes, but not ready to take help, sometimes for months or even years. So, today, let's talk about psychiatric medicines calmly, scientifically, and without fear. My goal is not to convince you to take medication, let me be very clear. My goal is to help you to make informed decisions based on evidence rather than myths. Namaste, I am Dr. Vrushali, and since 17 years, I have been working as a psychiatrist. One thing I have learned is that people are often not afraid of medication itself. They are afraid of the stories they have heard from their friends, families, from the social media about the medicines. So today, let's separate the facts from misconceptions. And I really want you to understand this and help yourself, or maybe in your circle, in your family, someone with clarity and the scientific knowledge about psychiatric medicines. Before we begin, the first thing I want everyone to understand is this: medication is only one part of mental health treatment. Mental health care may include education about that particular condition, lifestyle changes, better sleep. It also includes regular exercise, stress management, psychotherapy, family support, and, when appropriate, medicines. So, every person is different. Their needs, their diagnosis is different, their needs are different, their family support is different, the environment they are staying in is different, and their outcomes of the same problem, same diagnosis is also different. Not everyone who consults a psychiatrist needs medicines. Treatment is always depend on that person, their diagnosis. So it is individualized, totally depend on that person. Question 1: do psychiatrists only prescribe medicines? This is probably the biggest misconception. साइकियाट्रिस्ट सिर्फ दवाई देने वाले डॉक्टर्स हैं, दवाई खिलाते हैं, और फिर वो दवाइयाँ हमको हमेशा खानी पड़ती है? And the answer for this is no. The most important part of the work of a psychiatrist is making correct diagnosis. For example, someone may come with symptoms of depression, that low mood, and don't feel like working, don't feel like enjoy things the way the person used to enjoy before. For example, playing music, painting, or maybe cricket, playing cricket. So, interest in those things gets reduced, and slowly the person starts staying lonely or maybe frequent crying. So, these are the some of the symptoms of depression. Now, someone may come with symptoms of depression, but after a proper evaluation, we may discover that the symptoms are related to thyroid disease the person is having, or maybe a vitamin B12 deficiency. Certain medications because of that, or maybe some sleep issues or other medical condition. So, medication is not the starting point. Accurate diagnosis that what is the cause of these symptoms. Sometimes, after assessment, medication is not needed at all, and sometimes even therapy is enough. And sometimes a combination of therapy and medications give the best outcome. So, here was our myth 1. Do psychiatrists only prescribe medicines? So, the answer is no. Because sometimes only therapy is enough. That is, after assessment, we decide. And sometimes it's combination of medicines and therapy. So, let's move to the next question. Does everyone with a mental health problem need medication? Answer is no. Many people experiencing temporary stress, the loss in life, like some grief, adjustment difficulties, or mild anxiety, improve with psychotherapy, counseling, lifestyle changes, and social support. However, when symptoms become moderate to severe, when depression affects work and relationships, when anxiety becomes disabling, when OCD consumes hours every day and disrupts the quality of life, or in conditions like bipolar disorder or schizophrenia, where symptoms are beyond manageable, medication may become an important part of treatment because it helps reduce symptoms enough for recovery to begin. The decision is always based on person's condition, not on a fixed rule. Now let's see what is the question number 3. If I start medicines, will I have to take it forever? And the answer is not necessarily. This is one of the most common fears I hear. If I start medicines, oh my god, do I have to take lifelong? And that is the big concern when my medicines are going to be stopped. The truth is, the duration of treatment depends on several factors. It depends on diagnosis, severity of symptoms, previous episodes of the issues, risk of relapse, response to treatment. Some people need medicines for only maybe few months. Some may require it for longer period. Others with recurrent or chronic conditions may benefit from longer term treatment. There is no single answer that applies to everyone. Next question. Question number 4. Are psychiatric medicines addictive? People often use the word addictive for psychiatric medicines, but that is not accurate. Most commonly prescribed antidepressants are not addictive. Some medications, particularly certain anti anxiety medicines and sleeping tablets, can lead to dependence if used for long periods or without proper medical supervision. This is very important. Without proper medical supervision and without proper regularity, that causes disruption in the treatment. So, that is exactly why psychiatrists prescribe them carefully. They monitor their use. And to monitor the use, whenever doctor calls you, it's better to follow that discipline of showing up on that particular day and maintaining your regular follow-ups. So the medicine use can be monitored and review your medicines regularly. Never assume that all psychiatric medicines are addictive. They are really not. Let's see question number 5. Will medication change my personality? This is another fear many people have. The purpose of treatment is not to change who you are. The purpose of the treatment is to reduce the symptoms that are preventing you from being yourself. Many patients tell me, Doctor, I finally feel like myself again. Depression, anxiety, panic, OCD, these conditions often hide your natural personality. Treatment aims to help you reconnect with it, not replace it. Let's see the question number 6. Why don't medicines work immediately? Unlike a painkiller, many psychiatric medicines do not work overnight. For example, antidepressants often take several weeks before their full benefits become noticeable. That's how their mechanism of action is. This can be frustrating. Some people stop medication after 1 or 2 weeks because they think it is not working. But improvement usually takes time. That is why regular follow up with your psychiatrist is very important. Let's see the next myth. Question 7. Can I stop medication once I feel better? Feeling better is wonderful, but feeling better doesn't always mean the treatment is complete. Stopping medication suddenly can sometimes lead to withdrawal symptoms or increase the risk of symptoms returning. If medicines needs to be reduced or stopped, it should be usually done gradually and under the medical supervision. Your doctor will help you in this process. Slowly we taper and stop medicines. So never stop psychiatric medicines on your own without discussing it with your doctor, the doctor who is treating you. So, when might medication be helpful? Medication may be recommended in conditions such as moderate to severe depression, severe anxiety disorders, OCD, bipolar disorder, schizophrenia, panic disorder, some cases of ADHD, certain sleep disorders. But remember, medication is recommended after an assessment, not simply because someone has emotional distress. A thought I often share with my patients. I often ask my patients a simple question. If someone has a diabetes and needs insulin, would you consider that a personal weakness of that person? And most people say, of course not. Mental illness, maybe it's depression, anxiety, panic, or bipolar, schizophrenia, anything, also involve changes in the brain function and biology. When medication is recommended, it is not a sign of weakness. In fact, they are there to help you. It's one of many evidence based tools that may help the brain recover, just as a cast helps a broken bone to heal. Similarly, same way. Medication can support recovery, while other treatments, such as psychotherapy, healthy routines, lifestyle changes, social support, help build long term well being. So, let's see the learnings and what actions you can take from today's video. Whether you choose medicines, psychotherapy, or a combination of both, the decision should never be based on fear. It should never be based on social media, and it should never be based on what worked for someone else. It should be based on a careful assessment of your unique situation by a qualified mental health professional. As a psychiatrist, my goal is not to prescribe medication to everyone. My goal is to recommend a treatment that is most appropriate for the individual sitting in front of me. Sometimes that includes medication, sometimes it doesn't. Because good mental health care is not about giving more medicines, it is about giving the right treatment to the right person at the right time. If this video helped answer some of your questions about psychiatric medication, please share it with someone who may benefit from this information. If you have any questions you would like to address in future videos, leave them in the comments below. We will definitely think about those topics. And if you would like more evidence based, practical mental health education, don't forget to subscribe to the channel. Thank you for watching, and I'll see you in the next episode. Remember, mental health is not about being perfect, it is about understanding yourself, seeking the right help when needed, and taking one step toward healing, one day at a time. Take care.